Welcome to Easy A Homeschool Academy.
Everyday math. Math at the doctor's office. The quiet hum of medical equipment, the beeping of monitors, and the scent of antiseptic fill the air as patients step into a doctor's office. While the focus is on health and care, math is at work behind the scenes. From measuring height and weight to calculating medication dosages, every aspect of a checkup relies on numbers. Doctors analyze vital signs, track growth charts, and interpret test results using math. Even scheduling appointments and managing medical records involve calculations. A visit to the doctor's office isn't just about health. It's a real-world example of how math plays a vital role in everyday life. Today, let's take a trip to the doctor's office to see how many ways math is used. One of the first things the medical assistant will do to start a patient's visit is to check their vitals. He or she will measure height, weight, temperature, and check blood pressure. Math is essential in measuring and interpreting the patient's vital signs. Here's how. Height and weight. Measured in inches, centimeters, pounds, or kilograms, these values are used to track growth, assess health trends, and calculate BMI, which is an abbreviation for body mass index. At a routine checkup, a child is measured for height and weight. The nurse records a height of 4 feet 6 inches and a weight of 75 pounds. Since medical records often use the metric system, the weight needs to be converted to kilograms using the conversion formula. Weight, or kg, is equal to weight in pounds divided by 2.205. So, 75 divided by 2.205 is approximately 34.01 kilograms. The child's weight is recorded as approximately 34 kilograms. This conversion ensures consistency in medical documentation and allows doctors to make accurate assessments, especially when prescribing medication or comparing growth charts. Next, the medical staff will check the patient's temperature. Read in Fahrenheit or Celsius. Temperature readings help determine if a patient has a fever, hypothermia, or a normal body temperature. The nurse records the reading in the child's medical chart, ensuring the doctor has the most up-to-date information on their health. If the child had a fever, the reading would help determine the next steps for care. In some parts of the world, they use a different measuring system, therefore let's calculate the conversion from Fahrenheit to Celsius. In this scenario, the thermometer displays the child's temperature in both Fahrenheit and Celsius. To convert from Fahrenheit to Celsius, the following formula is used. C is equal to F minus 32 times 5 divided by 9. So, if the temperature is 98.6 degrees Fahrenheit, this is what we will do. C is equal to 98.6 minus 32 times 5 divided by 9. 66.6 times 5 is 333 divided by 9, approximately 37 degrees Celsius. This conversion shows that 98.6 degrees Fahrenheit equals 37 degrees Celsius. Doctors often use Celsius in many parts of the world, so this conversion helps ensure that temperature readings are consistent regardless of the measurement system. In the case of a fever, doctors would use these measurements to assess the child's health. Next on the checkup list is blood pressure. Blood pressure is expressed as a ratio, for example, 120/80 mmHg. Blood pressure measurements help assess heart health. The top number, systolic, represents pressure when the heart beats, while the bottom number, diastolic, represents pressure when the heart is at rest. Here, the nurse wraps the blood pressure cuff around the patient's upper arm and inflates it using a stethoscope to listen for the pulse. As the air is slowly released, the nurse notes the systolic and diastolic readings from the gauge. The blood pressure is measured as a ratio such as 120/80 mmHg, where 120 represents the systolic pressure or the pressure when the heart beats and pumps blood, and 80 represents the diastolic pressure, or the pressure when the heart is at rest between beats. These values are important in assessing the child's cardiovascular health. If either number is outside of the normal range, typically 90 over 60 mmHg to 120 over 80 mmHg for a healthy child, the nurse may suggest further monitoring or additional tests. This simple math-based measurement helps doctors determine if the child's blood pressure is within a healthy range. During the vital signs check, another thing the medical staff will check is BMI, short for Body Mass Index. BMI, or Body Mass Index, is calculated using this formula. BMI is equal to the weight in kilograms over the height in meters squared. Or BMI is equal to the weight in pounds times 703 divided by the height in inches squared. It helps doctors determine if a patient is underweight, at a healthy weight, overweight, or obese. To calculate the BMI for the child, we'll first need to convert the height and weight to the metric system. Step 1. The child's height is 4 feet 6 inches. First, convert the height to inches. So, 4 feet times 12 is equal to 48 inches plus 6 inches, which together makes 54 inches. Now, convert inches to meters. 54 inches times 0.0254 is equal to 1.372 meters. Step 2. Convert the weight to kilograms. The child's weight is 75 pounds. To convert pounds to kilograms, we take 75 and divide it by 2.205, which equates to 34.01 kilograms. Step 3. Calculate the BMI. The formula for BMI is BMI is equal to weight in kilograms over height in meters squared. Substitute the values for weight and height. BMI is equal to 34.01 divided by 1.372 squared, which is equal to 34.01 divided by 1.88, which is approximately 18.1. The child's BMI is approximately 18.1, which is within the healthy weight range for children. These calculations help medical professionals monitor health, detect potential issues, and provide the best care for patients. All the data is important, and it helps the medical staff properly attend to the patient. After checking the patient's vitals such as height, weight, temperature, blood pressure, and heart rate during a routine checkup, the next steps typically include the following. Health history review. The doctor will review the patient's medical history, including any previous illnesses, surgeries, allergies, vaccinations, and family health history. This helps the doctor understand any potential health risks. The doctor also performs a physical exam, which may include checking the child's ears, eyes, throat, abdomen, and reflexes, as well as listening to the heart and lungs with a stethoscope. Depending on the patient's age, symptoms, or health history, the doctor may recommend additional tests such as blood work, urine tests, or screenings, like vision or hearing tests, or cholesterol levels. For children, the doctor may assess developmental milestones, behavior, and cognitive skills to ensure they are growing and developing properly. The doctor will discuss any health concerns, answer questions, and provide advice on nutrition, exercise, and lifestyle choices. If any issues are found during the exam, the doctor may recommend treatments, follow-up appointments, or refer the patient to a specialist for further care. If nothing of concern was brought up during the visit, the doctor will schedule the next routine checkup, typically in a year for children, and may provide advice on maintaining health in the interim. If there are any health concerns, the doctor will advise on further actions or monitoring. In today's video, we saw what may happen during a routine visit to the doctor. The patient's height and weight were measured, with the weight converted from pounds to kilograms to ensure accurate medical records. The doctor then calculates the patient's body mass index, or BMI, by dividing the weight in kilograms by the square of the height in meters. Blood pressure is taken with the systolic and diastolic numbers recorded to assess the child's cardiovascular health. If necessary, the doctor calculates medication dosages based on the child's weight in kilograms to ensure proper treatment. Throughout the visit, math played a crucial role in helping the doctor evaluate health, make informed decisions, and provide the right care.
As always, thank you for watching. Tell us what you want to see next. Email ezahomeschoolacademy@yahoo.com. Like and share our videos. Please subscribe to our channel.